Ulcerative colitis is a chronic idiopathic, remitting and relapsing inflammatory bowel disease. Unlike the Crohn's disease, the ulcerative colitis usually starts in the rectum, and it is associated with continuous progress to the more proximal parts of the colon. It only affects the colon, and other parts of the gastrointestinal tract are not involved. And here we have the part of the colon affected by the ulcerative colitis. The inflammation is typically superficial, and it affects only mucosa. The deeper structures are spared. Here we have the ulcerations and the partially affected mucosa. In between the ulcerations create inflammatory pseudopolyps. On higher magnification, we can see the typical distortion of the architecture of the crypts, which is a sign of chronicity of the inflammation. The normal colonic crypts resemble test tubes. They are regular and they go all the way from the surface to the lamina muscularis mucosae. And this is not the case here. We can see really irregular crypts. The lumen of the crypt on the cut surface can look like continents or animals. It is basically irregular. Here we can see the crypt drop out or atrophy of the crypt. The lamina propria of the mucosa is infiltrated by the lymphocytes and plasma cells. The typical for IBD is basal lymphoplasmacytosis, where the crypts do not reach the muscularis mucosae, and in the basal part of the lamina propria we can find a lot of lymphocytes and plasma cells. The neutrophilic infiltration marks the activity of the inflammatory process. So here we have the neutrophils inside of the crypt, and this is called the crypt abscess. Another crypt abscess is here. In this part of the slide we can see ulceration with a superficial purulent fibrinous exudate with fibrin and neutrophils. The inflammation is limited to the superficial portion of the colon. Deeper parts, as submucosa muscularis propria and subserosa, should be without inflammation. The correlation of the histological findings with endoscopic and clinical features are always important. And sometimes it could be quite difficult to differentiate ulcerative colitis from the Crohn's disease. And in these cases, we can use the term indeterminate colitis. So what are the main differences between ulcerative colitis and the Crohn's disease? Well, ulcerative colitis is a superficial inflammation. It affects only colon. It starts in the rectum and progresses to the proximal parts. However, the Crohn's disease typically involves terminal ileum, but it can involve any part of the gastrointestinal tract. The Crohn's disease is associated with skip lesions, where part of the gastrointestinal tract are affected and parts are without inflammation. In case of ulcerative colitis, we do not typically see fissures and fistulas because the inflammation is only superficial. Thanks for watching.